Welcome to the Genetics Podcast. I'm really excited to be here today with Seb Tucknott, who's an entrepreneur, author, and patient advocate. Seb was diagnosed with ulcerative colitis, which is a form of inflammatory bowel disease, when he was 21 years old. In 2015, he founded IBD Relief, which is a website that allows people with IBD to share their experience and access support tools. And then in 2019, he wrote a book called Tipping the Balance, which is about how he radically changed his diet and lifestyle to get his ulcerative colitis at bay. So Seb, welcome, and thanks so much for taking the time. I followed you on Twitter for a while. You're one of those people that has taken a problem that they experience personally and turned it into a solution, which is always amazing to see. So first of all, welcome, and wondering if you could maybe just take us back to 2008 when you first started experiencing your symptoms and talk about some of your experience.
Yeah, definitely. Well, thank you for inviting me on. I go back to 2008. My first symptoms was going to the toilet and there was blood in my poo. Didn't really know what that was. Went to the doctors, was told I had a hemorrhoid with no investigations. And then, sort of long story short, I, over the course of 3 weeks, lost about 10 kilos. I was going to the toilet 40 times a day. Went to A&E a couple of times. First time again, got turned away with a hemorrhoid. And then the second time, finally someone actually decided to do an investigation and they suspected that I might have ulcerative colitis. Went on to have a sigmoidoscopy, which is a camera up your bum, to kind of see what's going on, and was diagnosed with ulcerative colitis and spent 9 days in hospital. And that was like the first time I've ever really experienced the healthcare system properly. First time I've ever stayed in hospital. And that was quite a scary experience, I suppose, when I was 21.
Yeah, absolutely. So how much did that shape your experience or your decision later on to found IBD Relief? I guess it was about 7 years or so between then and when you ultimately founded it, but I'd be interested to hear how that came about.
It certainly opened my eyes up to healthcare. So I had at the time I'd run my own business for about a year or two. I've always been interested in science and sort of health and medicine. I did think about studying medicine at a university. I wasn't quite academic enough, so didn't get the grades, and went on to study chemical engineering. But I think being in hospital, it was like, I just saw quite a lot of things. I was like, oh, okay, they're doing something like this. Could that be better? Or like, I like to solve problems. I like to make things more efficient. So straight away, I sort of saw a few things and became interested in the healthcare space. The big thing for me, sort of moving on throughout my sort of initial few years of living the disease, was just my real surprise at the lack of information given to me. When I was diagnosed, it was very much, you've been diagnosed with ulcerative colitis, here's your medication, go and get on with the rest of your life. There was no real guidance in terms of what was going to be there thereafter. Then the other thing as well was, like I've worked in, I run a web design and marketing company, so I've been in sort of tech, and I was really surprised at the very lack of asking me any questions about me as a person. So it was like, I was never asked, like, do I smoke? Do I go out drinking all the time? Like, what's my lifestyle like? Is there any history of anything in my family? All kinds of different things. And I started sort of thinking about these questions around, like, I'd had hay fever I'd had asthma when I was younger. Like, were those in any way linked to my condition? So I sort of started to have sort of those questions. The real thing for me was my frustration with my care team, where I would go to them and say, oh, I've noticed that I'm getting stressed and that's causing my disease to flare up, and being told that, oh, that doesn't make a difference. Like that's a load of rubbish. And it was like, well, I'm pretty sure, like, I know my body, like, this is definitely making a difference. Like, every time I get stressed, I have a flare up. And I'd noticed other sort of patterns with my life. So the initial motivations for IBD Relief was like, hang on a minute, why can't I kind of gather data from patients? not that hard using online tools. Can I create some evidence to go back to my doctor and say, you know what, I said this makes something worse and 1,000 other patients also agree with me, so maybe you should listen. So it kind of started from that. I also got involved in a Facebook group with lots of other patients. It was the first time that I had met anyone else with the disease. I'd spent sort of 4 or 5 years, never met anyone with the disease. And again, that really opened my eyes up to like, actually, you know what, there's loads of people going through the similar stuff to me. There's loads of people with questions. I took it on myself to like try and help people with some of their problems or their questions. I was like, oh, I'll go and like try and look that up, or it sort of intrigued me. And again, I just saw this wealth of information that was in this Facebook group, but it was so fast paced. So it was like someone would post
over every 5 minutes, right?
Yeah. Like someone would post a question, you'd get 10 responses, then an hour later someone would post a similar question, and then you'd get a completely different set of responses. And it's like, depending when you post and who's online, it's kind of potluck as to what advice you get, and that advice could make a massive difference to your life. So it was like, again, is there some way that we could kind of aggregate this, or try and like Quora style, where it's kind of like kind of upvote some of these questions? Because I saw some advice on there that was like really life-changing for people, but then also stuff that was like pretty damn scary. And it's like, there's no way of controlling that. So that was kind of the very beginnings of setting up IBD Relief.
Yeah, you anticipated one of my major questions, which was going to be how does, there's an enormous ecosystem on Facebook that a lot of people use, but clearly it wasn't built for this, and there are also issues about data privacy that people are concerned about, but also just simply the structure of the platform isn't necessarily built from the ground up. So I'm curious whether you see an opportunity for what you've built to kind of tailor this experience a little bit more to be used across other disease areas, or if you think that are you laser focused on IBD because there's such a huge patient population and so many specific kind of problems or solutions there. I'm just curious about how you see whether this can affect other chronic or rare conditions.
I think, well, there's sort of a few questions there. One, I've begun to learn that other long-term chronic conditions, and particularly the other autoimmune diseases, there's so many similarities. I'm super passionate now around education and how we can better inform and empower patients to understand their disease, whatever disease that is. Because for me, I always say to people, I wish I'd met me now 12 years ago or 13 years ago, whatever it was, because like the stuff I know now about my body and how things work and my understanding of the disease and like so many different things is like incredible. If I had known those things early on, it would have really helped me massively changed my life. So it's, how do we give access to that knowledge? Both, I think just from a basic level, like the knowledge that's shared with patients is pretty poor across the board anyway. I mean, there's patients, we saw it with COVID, like patients being told to shield and patients going, I don't even know if I'm on an immunosuppressant drug or not. And like, the patient should know that. They may have been told, they may not have been told, but again, that's information they should have. So how do we improve this at that basic level? But then it goes much deeper in terms of like, how do you live with this thing? How do you improve your quality of life? How do you deal with relationships? How do you deal with psychological problems? How do you deal with work, school? Like there's just so many different things. And I say to people now, it's like you almost need like a degree to in your disease to live with that disease, and that's going to help improve your quality of life. So that's the area that we're spending a lot of time on at the moment, is around how do we improve that education journey and that information journey. Will we spread that out into other disease areas? Possibly. We're focusing on IBD right now because it's something that we understand, and I wouldn't want to claim to understand things about other disease areas. But there's definitely that opportunity. I think if it's not us, like someone else can do it, and we would be interested to sort of help kind of share our learnings. And I think you can translate that into other areas. Yeah.
What you mentioned about kind of becoming an expert in your own disease, I did my PhD work in rare neurodevelopmental disorders, and it's amazing the parents that you meet that become an expert in their child's condition. I've had a few on the podcast. So, Gillian Hastings Ward is one great example. She is the chair of the Genomics England participant panel. Her child has a ultra rare disorder, and often the parents and the parent support group are amongst the foremost experts in the world on the condition, because they have to be. And I think this is the case for almost everything except the absolutely most common conditions. I was curious, though, to follow up on the thread of you wanting to have met present day you in the past. What is it that what are the big things that you've learned that you wish you had to impart now? And I think this is a big topic of your book probably as well. So maybe we can segue into that.
Yeah, I mean, yeah, so much. And at the same time, I don't think I could explain 12 years of insight in a short period of time to my former self. But I think the key things would be that I have a massive role in my health. Like, I think when I was diagnosed, and I think we have this in the healthcare system, particularly here in the UK, it's kind of the doctor will fix you. So it's, I have a problem, I'm going to go to the doctor. They know everything. They're going to give me a treatment. I'm going to be cured. Like that is the simplistic view that we have. And I now know that that's very much not the case. They still play a super important role, and I'm really grateful for the care I've had. And without them, I would most certainly have lost my colon and things like that. So they're part of it. But I think what I've learned is the more I can take some control in my health, and there's things I can do that's going to help make me better. I think that's probably would be kind of the underlying thing. It's then just about working with my former self, my naive self, of like, okay, these are things you can do. This is how you might start to change some of your behaviors. This is the things that might improve your quality of life. And my book goes into a lot of how I do that now. In essence, I look after my health by focusing on, they're kind of like very basic fundamentals of health. So I look after my sleep. I try and get as much sleep, not as much sleep, as good quality sleep as possible. So it's about quality, not just quantity. And I've learned so much from tracking my sleep and understanding my sleep. My mind. So again, managing stress. Like at first it was focusing on stress. So I run my own business. It's stressful. I'd noticed that every time it was payday, I would have a flare up because I didn't have enough money to pay all my employees. And that was quite stressful. So think like learning coping mechanisms of how I can reduce that stress. But now I kind of gone further into actually, you know what, mind and stress is not just about stress. It's about happiness and enjoyment and pleasure and things like that. So actually you can be not stressed, but you can still not be happy. So working on kind of those things. Diet and nutrition has been a big part for me. I was very fixated on diet for a number of years. And I think, again, now I've learned that there's more to health than diet. I think a lot of people get fixated on, I need to have the best diet, and that can end up causing more stress. And there's a great saying I heard, it's better to eat the wrong foods with the right frame of mind than the right foods with the wrong frame of mind. And I think that's so true. And I think there's times it's like, you know, I will smash a chocolate bar. It's not going to kill me. It's fine. Like, I enjoy it. And I've definitely been stressed in the past over food, which has caused a negative impact.
Yeah, absolutely.
And then the final things around like movement and stuff as well. So keeping active, keeping my body moving, and that's certainly helped.
No, that's great. I was interested in what you've also seen as evolution or lack of evolution in terms of the healthcare teams over that time period. I will encourage people to go listen to another podcast you're a part of, which is called the Functional Health Podcast, where you told a long story of your diagnostic odyssey, and you referenced almost losing your colon earlier, which you go into some detail there. But I think one of the challenges of the healthcare system is this long held belief that you said that the doctor will fix you and the patient has no role to play. And while that is changing, little by little, I think it's still the case in most parts of the world and for most people that, they don't necessarily feel like they have that power. I'm interested whether, you've seen any of that change, or if you have any, specific personal experience with how to advocate for yourself, for lack of a better word, or bring that data that you might be collecting to the healthcare team.
I think there's definitely been some improvements, but we're still a very long way off. I've had the privilege to work with some of the leading teams in the UK now in IBD, and I can certainly see that their teams are far more set up to deal with understanding the person as a whole. But even them, they're still a very long way off. And in my own personal experience, in my own personal care, like they just don't have the time or the resources. I mean, I have maybe two consultants and one IBD nurse for a population of 3,000 IBD patients. Like you cannot deal with it. Like it's impossible. So I think there's some interesting stuff around. I'm super interested in how we can start to empower other patients to help take some of that burden off. I think, again, I've had the opportunity to work with quite a few patients with inflammatory bowel disease, just on a really informal basis, but seeing how much their condition improves just by having the opportunity to talk with someone that understands and actually talk through things has had a really remarkable difference to a disease. And I think there's definitely some opportunities that we can empower patients to do that. And that's something that we're looking to try and do further down the line with what the work we're doing. I think the problem stems from the healthcare system was set up in a time where we were facing kind of more acute problems. So infections or traumas. So again, if I break my arm, I want to go to a doctor, they're going to fix my arm. And it doesn't really matter how I broke my arm particularly. It doesn't matter who I am as a patient. They will just fix my arm. It's fine. It's done. Whilst when it comes to these complex conditions, it's then very much about the patient. And I think then the patient matters a lot and the diagnosis probably doesn't matter. And I think that's where we're seeing so much now, actually, whether you're diagnosed with inflammatory bowel disease, rheumatoid arthritis, multiple sclerosis, all these things, actually maybe some of the fundamental things are probably quite similar and the diagnosis doesn't really matter.
Yeah.
It's more the way I touch on this in my book, and I talk to people a lot now, I see the diagnosis with a complex chronic condition is more like being diagnosed with debt. So you can have debt, but that can mean so many different things. It could mean you have a big mortgage, or it could mean you've got a load of credit cards, or it might mean you're nearly bankrupt. And how you got into debt and how you get out of the debt will very much depend on that individual. So the diagnosis doesn't really matter. It's then about how you manage that. And I hope that's a sort of a way that people can kind of look at things slightly differently.
Yeah, that's super interesting. And I think it means that you really have to worry less about tests and getting to the root of how we got here, but more about what is the current state and how do we move forward, right? Yeah,
definitely. And looking beyond that diagnosis. I've definitely seen stuff where it's I've gone back with symptoms and it's oh, okay, that's just your IBD. And we can't investigate that further. And actually, you know what? It might be I definitely believe I have irritable bowel syndrome, so IBS, as well as my IBD. So, and actually there's stuff I have been able to do with my IBS that has then improved my quality of life. That isn't I've been in clinical remission with my inflammatory bowel disease, but I still had some bowel problems. And that was down to more functional problems that could be addressed. But in the past, if you go to a doctor and say, oh, I've still got diarrhea, it's well, tough. That's just part of having IBD. And it's well, actually, there's more that can be done. I think, some patients, a lot of patients get very annoyed at the getting IBS and IBD confused, which is frustrating, where people go, oh, I know that I've got IBS. It's no, it's very different.
Yeah, it's very different.
But also I think you can have both, and don't settle for you have the disease and that's kind of tough. Maybe some of those things are tough, but I think I'm just someone that always is is there something more I can do? Is there something more we can figure out? How can I improve my quality of life more? If that makes sense.
Yeah. So how does IBDrelief.com work? I had to play around. It looks like it allows, you can hear my dog barking, having a good time over there. It allows people to connect with other patients in the first instance, right? Is that to share experiences and support? I think you mentioned this earlier as some way of relieving the burden on the healthcare system, right? If you have 3,000 patients for a single nurse and specialist, there's really no way. And so you need some kind of peer support network really to pick up the slack. Yeah.
So IBD Relief has kind of become a number of different things. It started off as the website, which is still a useful resource for lots of people. And we get, I think we get nearly 100,000 people a month visiting the website. And it's very much just around information. So if you Google something, we generally come up and it's got a useful article. So that's kind of IBDrelief.com. We did have the Connect thing, which we played with. It never really took off to where I wanted it to go. So we've kind of put that on ice a little bit. Then as a company, we're sort of working on like other different projects within inflammatory bowel disease and the sort of the digital health space. So we have the website. That's kind of a place where we can reach patients and help patients from an information perspective. We've then spent a lot of time working on this education platform, which is this kids app that we're just trialing at the moment. So we're working on a way of where the healthcare teams can kind of prescribe information and education to patients. So when you go to a clinic appointment, if you are just diagnosed and you're about to start a new treatment, the doctor, rather than just having to give a leaflet or something like that, can actually say, well, okay, you have this type of disease, you're starting this treatment, and you're maybe going for a blood test. I can prescribe to you some e-learning, some video courses on this is what the disease is, this is what a blood test is, this is the disease you have. Because what we found is patients want to learn a lot from their doctors. The doctors just don't have the time. So you have your 10-minute appointment. It's impossible to get all the information across. So we spent a lot of time working with the healthcare teams. We started in pediatrics because they've got a little bit more time on their hands, and we just wanted to sort of start small and kind of understand that area, and then we're going to scale it up into adults later this year, is to go and film with those healthcare teams. So, okay, tell me everything about a particular treatment, or tell me everything about it. And we've now shot videos with the whole healthcare team. So we started with Adam Brooks Hospital in Cambridge. So we've got probably 10, 15 hours of footage with their team talking about all these different aspects, which, I mean, I've probably had an hour with my consultant in 15 years. Yeah. So we've got 15 hours of footage with their care team. And then we've also got loads of footage with other patients and parents and things like that. So we're now putting that together. So when you have your clinic, you can have your 10 minutes and they can say, okay, we're going to start you on azathioprine treatment, for instance. Go and watch. There's 20 minutes of videos on this. Go and watch that in your own time. You can watch as many times as you want. It's really simple, but we believe it's going to make a big difference.
Yeah, and I imagine you can cover off 80% plus of the questions from 80% plus of people, which is an enormous amount of benefit to the patients and time saved, right? So it's so highly curated that you're getting the best and most up-to-date information. I think it's brilliant. It makes total sense. Why haven't we done this before?
Yeah, I mean, I keep coming across that in healthcare. It's like, yeah, why is this not being done? But okay, we'll give it a go. And I think the fascinating thing will be now. So we're in the space now where we're testing this now with the first cohort of patients at Adam Brooks. We'll see it's going to reduce the amount of time that they're talking about certain topics, but I think it's not going to. Hopefully they're going to be talking about more specific things and more specific questions, and the patients and the families can go in feeling more empowered, more knowledgeable about that subject, and then can sort of get down to the things that are going to make a big difference to them rather than having to cover. And that was something we learned a lot with the healthcare teams, is like, they're getting a bit bored of just having they would have the same conversation with 10 patients every day. It's like, I'm just reading off the same 10-minute spiel. And also the variation, like if they're like hungry because they're about to go to lunch, like the conversation they have is not quite as good as the one they had when they're fresh in the morning or whatever. So again, you're capturing it in the best way, making that a lot more useful. And also where we've now sort of talking to other hospitals, we found like the best person that's really good at explaining endoscopy and the person that's really good at explaining this drug. And you can then scale those to that person across the country rather than, and hopefully free up that time for the healthcare teams to focus on the things that really matter.
Absolutely. Well, one of the other big issues that I think there is, and I'm interested if you have another clever solution for that, is the difference in level of access to skilled consultants or doctors. So someone who happens to be born or live in the place where the chief gastroenterologist who knows ulcerative colitis up and down has luck of the draw that they've got a great experience, but someone who hasn't, how do you bring that expert opinion or experience? So I think the videos are a brilliant way because you can get a lot of that expert opinion, but then for the follow-up of the long tail of questions and personal experience that is I think what doctors want to spend their time on anyways, right? Like you say, not answering the same 10 questions over and over, but really digging into the individual. Do you have any ideas of how you can scale that expert contact?
I think whether it's something that we tackle in the future, I don't know yet. I think there's a real opportunity now that COVID has presented, is the whole kind of remote clinic telemedicine stuff that we've been talking about for years, but it's never got anywhere. And then suddenly within 48 hours, it's like, whoa, everything's online. And suddenly we're doing remote clinics that everyone said was impossible to do. So I think there's definitely that opportunity there where, we're having a conversation now over the internet. Like, it's not quite the same as face-to-face, but if that's a better expert, then why not? And I think hopefully there's an opportunity where we can, if there is an expert that's at the other end of the country, they could use one of their remote clinic, and can we share that resource across the country and get the right person for the right healthcare professional and do that digitally rather than this kind of postcode lottery now of, which hospital you're going to be under.
Yeah. How much time do you spend now thinking about not the individual kind of care and what you can do as an individual to improve your your state of health, but some of the up and coming precision medicines and things that people really like to talk about but may not deliver immediate benefit? Where do you see the balance in terms of the basic stuff like you were talking about earlier, sleep, lifestyle, diet, versus some of the precision therapies, gene editing, even using genetics to preventively screen or at least detect early whether you might be at risk for UC or Crohn's or other inflammatory bowel disease subtypes. I'm just interested in your thoughts on whether the research is overhyped and we're over-indexing on it, or whether it is actually an important piece of the whole puzzle.
My personal opinion, I think it's probably being explored not too much, but I think the other stuff isn't being explored either at all or enough.
Yeah.
So I think we would definitely learn some stuff, and I know you do a lot of work in sort of genomics. Like, we will learn some interesting stuff, and that's certainly going to help. And I think inflammatory bowel disease as a disease group, there's probably, I was fortunate to interview a geneticist last year, and she was of the opinion there's probably like 25, 30 different subtypes that are completely different. Like, is it genotype? Sorry, I'm going to get this wrong.
Yep.
But,
yeah, you got it.
And they could effectively be treated as completely separate diseases. They have the same symptoms, but the underlying pathology is different. So we need to be treating that in a different way. So I think we can definitely learn some interesting stuff there. My frustration, I suppose, is just there's just very little, if any, research in some of the stuff that I've realized has made a huge difference. I mean, even sleep, for instance. I mean, I've improved my sleep, and I now know if I'm tracking my sleep all the time, if my sleep drops off, my symptoms will start to present itself. And when you start to dig into science, there's some like super fascinating stuff around the role of sleep on your immune system or like regeneration of cells. And like, so there's some pretty interesting science there. And I think for a long time, it's always been like palmed off as like alternative therapy or alternative medicine. And it's like, oh, it's not science. It's kind of pseudoscience stuff. And it's like, actually, there's some really fascinating science there. And I mean, yeah, hey, what we could do a study and say, if we could improve everyone's sleep by 10%, we would improve quality of life by a huge amount. Like that's something we can do right now rather than worrying about some gene therapy or something like that. That's a lot further off. And when I see the money flying around in research in some of these like more specific areas, I'm like, I think that's maybe where the future might be, but there's some stuff we could be doing right now that's going to make a difference to patients right now.
Do you think this is a failing of the way that the economics of the healthcare system are set up? Because I'm conscious that some of the ideas that you have and have shown to work, nobody makes money off of these, right? Maybe in the NHS, it's probably a little bit different in theory, although maybe it's not in practice. But in theory, if you could convince everyone to sleep better and reduce adverse events, it would be great. But I know in the US, nobody's getting paid, at least most people aren't getting paid to help people sleep better. I'm wondering if you think that needs to change.
Yeah, definitely. I think I hear a lot of doctors or people in the research space and patients about like, oh, I'm not going to do that because it's not evidence-based, or there's an evidence for that. And it's like, just because there isn't evidence doesn't mean it's not real. And particularly for some of this, whether we call it softer stuff, we're not going to, I don't think we're going to kill anyone by telling them to try and have a look at their sleep hygiene or something like that. So why don't we just give it a go rather than worrying about putting it through a great big RCT? I think, the payment incentives is a big one. And I completely get that. Like, who is going to make money out of better sleep or better diet or meditation or something? Like the money isn't really there. However, like you said, there is potentially in the healthcare system, there is the money in the NHS. And that was my frustration early on. It was like, for me now, I've been medication free for about 3 or 4 years now, live really well. I feel like the healthiest I've ever been. Like, I'm not cured. It's still there and it would come back if I do the wrong things. But when you look at the economic studies, inflammatory bowel disease costs around £3,000 to £4,000 a year per patient. So I've gone from, let's say, costing, I don't know, like £1,000, £2,000 a year to now pretty much next. I mean, I haven't had an appointment in about 18 months, so nothing. Like, that's a huge cost saving. Right? Yeah. Why, if we could just take what I've done and do that to 5% of patients, like, that's a huge cost saving. So does the NHS invest in that kind of stuff? Not really. I think it's so caught up in trying to deal with now, and like even more deal with now with COVID. Like it's very reactive rather than proactive and looking at, and people talk about prevention rather than treatment, but I haven't really seen it happen in reality, to be completely honest. What
would the top 3 to 5 things that you have done over the last 12 years that have made the biggest impact? And maybe it's more than 5, maybe it's a number of things. And if so, say so, but I'm wondering if there's 3 to 5 kind of top specific things that have really moved the needle for you.
I think it's lots of things. I talk of it as kind of like an incremental approach. So I probably do 100 or 1,000 things every day, or like I've changed lots of little things. And each one of those things has improved me by 0.5% here or something like that. So I'm, in terms of my inflammatory bowel disease, it's just as well controlled now as when I was on some of the stronger medications. So one medication had, I don't know, 100% effect. I've had to make up 100% by lots of smaller percentages. Yeah. In terms of the big things, I mean, I've talked a lot about sleep. So I think improving sleep has made a big difference. Diet's been pretty big, but like very broadly speaking, I eat a sort of like nutrient dense. I eat naturally. My general kind of rule is if it's got ingredients on it, then I'm probably not eating it. Like I try and cook from scratch, and like there will be times where I don't do that because I'm lazy or whatever. That's fine. But again, that kind of 80-20 rule of like trying to eat well as much as I can, and I think that's made a big difference. Stress and taking time out and just trying to. There's a guy I came across it's called the Urban Monk, and it was like he went and like became a monk for a while, and then he was like, how do I apply it? Like, that's just not realistic. Like, you can't live like a monk or a caveman in modern society. How do you apply some of those principles into day-to-day life? So it's kind of like, I've got a standing desk now. So I'm moving around a bit more in my day while I'm working, or I do my phone calls while I'm where I walk. So I'm getting exercise. So it's trying to like hack into my day, little things. It's just going to make those small little gains in my health. That's going to make a difference.
Have you thought about turning that into a product in some way? I think the one thing that all healthcare systems are good at doing is figuring out how to pay for products that you run through an RCT. I'm just wondering whether there's a 50-step personalized plan that you could build into a mobile app or something.
Yes,
like the most
probably. I think if some people want to invest some money and I would happily give it a go, and I think we could get quite far, and particularly with some other experts and people with experience in this field. But it requires a lot of time and testing and effort. So I haven't tried to. I'd love to tackle that, but I haven't because I just don't have the resources to do so. And for us, that's where we were starting with the education. Because I think long term, we want to move into the education of like, actually, we can teach some of these people like some of these basic principles. Yeah. But again, even if you talk to me 12 years ago, I would have like probably laughed at some of the things I do now. I definitely would have laughed at some of the things I do now. So it's also about hitting the person at the right time. So for us, it's like people at diagnosis want to know more about their disease. They want to know about the treatments. They want to know about all the conventional stuff that they believe is what they need right now, which is probably true. And then we can slowly build their trust and move them into some of the stuff that's going to start to help them. So we're focusing on the stuff that isn't controversial, is going to be supported, and then we can move into some of the other stuff. And we're working with a few researchers to sort of explore some of these other areas as well, which will be super interesting.
That's great. So any investor who does want to fund your app, they can find you on Twitter. I was interested as well in, you've done some work with large pharmaceutical companies. I believe you're on the Janssen some advisory board for patient-centered approaches. I was really curious around how that came about, and also how you've seen the pharma industry change over the last 10 years, because I don't think this was as common in 2008, but it seems like a lot of companies are taking what you're saying a lot more seriously, and clearly they're employing in a part-time capacity people like you to help them see the future.
I think so. For me, I run my own business for some time, so I understood the benefits of networking or getting to understand people, and I felt my mission is to try and improve the quality of life of patients living with inflammatory bowel disease. Like that is what drives me, and that's what I want to do, and that's what's super rewarding. So how do I do that? I've got to understand or influence in some way the different aspects of the healthcare system. So quite quickly I was like, I need to get the NHS on board. I need to get the doctors on board. I need to understand them, understand how they work, understand their challenges. Because I think I see some patients that will be like getting frustrated at the healthcare system, saying, "Oh, why is it like this?" But if you don't understand the other perspective, then it's quite difficult to find a solution. So I've sort of forced myself to go and spend a lot of time in healthcare, in pharma, and that kind of stuff, just to understand that landscape and understand where those challenges are and how we can then all work together to actually make a difference. So I'd started to sort of get involved with pharma a little bit in terms of doing like a bit of public speaking, sharing my story, that kind of stuff. Then I'd always been a big believer of you need to understand your market. And I'm always fascinated by healthcare as it's one of the few industries where they don't seem to talk to customers. And if you treat the patients as the customer or the user, like they don't seem to talk to the users. Yeah. They talk to doctors, but they don't talk to the patients. So many things when like, you've just spent millions of pounds creating this thing that patients are not going to use because they don't need it. Like you haven't understood them. And it makes no sense. So started to get more involved in the whole kind of patient centricity movement, ended up getting this role with Janssen, which is the patient advisory committee, which has been like super interesting. I've been involved for about 18 months now. And that is as 10 patients. We're not a big fan of the word, but like patient experts. And we challenge them on stuff they're doing. So it's like, have you involved patients? Is this going to have direct patient benefit? And it's been super fascinating to try and sort of understand some of their challenges and understand how can we make that whole system more efficient and more focused on the patient goals. Because if we can align everyone's goals to be the same one, then we're going to make big advances forward. So yeah, I've been doing a lot of work now in the patient centricity thing. And it's very much around, I'm a big believer now, you need to get the right patients at the right time. There's a lot of stuff. It's like we're put together a patient advisory board or a patient panel or a focus group. And a lot of the time it's just a random mix of patients, which in some circumstances is super useful, but in other instances is not useful. So like I would say, like if you're going to do a digital project in inflammatory bowel disease, I have worked in digital for 15 years and I'm a patient. So not only can I give you the patient experience, but I can also give you some good digital ideas. So I can wear both hats and I can then bring forward ideas that it's like, okay, you could use this digital solution that would help patients because I understand both sides of things, rather than just going, this is a problem for me, but I don't know how to fix it.
Yeah, absolutely. Why do you think they have not traditionally spoken to their customer or end user? And do you see it changing dramatically, or is it going to be a inch by inch thing?
I think it comes back to what I said around healthcare has come from a place of trying to deal with acute problems. So the patient's view didn't matter or doesn't matter. So again, like I would not know how to fix a broken arm and I wouldn't ever claim to do so. Whilst the patient experience plays a massive role in these long-term conditions. So I think when we've been dealing with the more simple or complicated problems, that is where you need the experts, you need the researchers, you need the doctors, and their experience is vital. Now we're moving to these complex conditions. Actually, you know what? Their experience is useful in certain aspects, but really not in lots of other aspects. So that's where now the patient voice is more important than ever if you're working in that space.
Yeah, and I think your worldview could be viewed as threatening to a pharmaceutical company because you've said it yourself that you've been off your medication for 3 or 4 years because you have tweaked your lifestyle in order that you don't need it. But I think that the really good ones won't see it as a threat. They'll see it as our business model is helping patients get better, right? It's not selling injections or selling pills. So I assume Janssen and the other good ones are thinking about how do we embrace digital technology and think of what the true job to be done of the patient is, which is to feel better and get back to a state of health, not to ship pills.
Yeah, definitely. I think we need to, it comes back to the why. So why do pharmaceutical companies exist? It's to improve health. For the last 50, 100 years, selling medicines has improved health and done some amazing things. But now we're moving into some spaces where that's not the only answer. So if they want to just sell pharmaceuticals and medicines, then I think they will, well, there's always going to be maybe a place for that, but they will struggle. If you're then starting to embrace other parts and it's actually focusing on, we want to get that patient better, if that is through a medicine or through a digital therapeutic or a coaching program or whatever, like that is important for the healthcare system. Yeah. And I think pharmaceutical play a massive role in that because they have the resources, the insights, they can do the trials, they can understand this stuff. And I think we're already seeing so much investment in like data and precision medicine. And I still think there's massive roles to play with pharmaceutical treatments. And I think for me, I see, coming back to my debt analogy, I see pharmaceutical interventions as kind of like loans. So it's like, you've got yourself in debt. Here's a loan. Now you're back on your feet. Now you can make some changes that are going to keep you there. Rather than at the moment, I think we're just handing out loans constantly, and then eventually the loans start working, and then you're screwed.
Yeah, and I think with my genetics and biology hat on, if you take something like ulcerative colitis that has a genetic underpinning, it's not in any way the whole story, but clearly there's something happening very complex on a biological level over your entire lifetime, because you have you're born with the set of genetic variants you have, and you're arriving at a state of 21 years old with an entire lifetime of biological processes that got you there. And then to expect that you could find a chemical that you just kind of chuck in and it undoes 21 years of complex biology it's amazing that any of them work. And I think that's the flip side of it, that actually we, with any complex disease, that there are, single biological entities that can do that. But equally, I think we need to think about whether we're really expecting too much out of these, what is the upper limit of medicines, and where do we have to bring a more holistic approach in?
No, I completely agree. And I think we are probably hitting that peak now. It's like finding, so Roche, for instance, have just invested huge amounts of money in a new biologic that their phase 2 trial has not had quite the results they're expecting. And it's like, huge amounts of money plowed into one molecule that is hopefully going to make that big change. And hopefully they will find some other things that will work, but it feels far too simplistic. It's like it's so complex. And I've seen it time and time again. I see patients that are being flipped from one medication to another. And when you look at their life, like they're in a really stressful job, or they're like in a really bad relationship, or their lifestyle isn't great or they're depressed. Like there's so many other complex factors. I think maybe if you dealt with some of those things, it would then maybe make that medication work. And again, I think we need to review the trial process. So coming back to that Roche treatment, you only really allow, I don't know if this is correct, but they trial it on patients that have failed other biologic treatments. Right. And then I think they're the more complex ones. And it seems a shame that this biologic might be a better option for biologic naive patients, but now it won't be licensed because it doesn't work on the hardest patients to deal with, that possibly no biologic is going to fix. Whilst that treatment could have been far safer, far more suitable to some of the other patients that are on some of the anti-TNF inhibitors and things like that. So it's kind of, it seems a shame that we're just taking that simplistic view when actually there's so many different pathways involved here.
Yeah, absolutely. Well, Seb, I just want to say thank you. This has been an incredible conversation. Just to wrap up here, I'm just curious about, for you personally, what is it that you're working on now and most excited about for the next few years?
So for us, it's we're really interested to see where this education platform is going to go. We're aiming to have that being tested by 5 pediatric centers by the end of the year, and we're also going into adult care as well. So I have some big hopes for what it can achieve. So hopefully we can start to realize that. Stuff has moved so quickly and stuff has changed so much in the last few years, and like even more so in the last 6 months with COVID. I have no idea where I'm going to be in 12 months time. I think I have like some big ideas, and but at the same time, just taking it each day as it comes, and seeing. I think you've got to learn fast from what's going on and be prepared to change. So yeah, just super excited to see where that things go, where we can take that, and hopefully make a big difference to patients.
Great. If people want to keep up with you, I know you're at Seb Tucknott on Twitter. Do you have a personal website, or is ibdrelief.com the best place?
So I'm not massively active on Twitter, but I will start to try and do that again a bit more. I'm probably more active on Instagram, but I think I'm the only Seb Tucknott in the world, so I'm not that hard to find. So yeah, find me on Instagram and Facebook and LinkedIn. I have my own website, sebtucknott.co.uk, but that's more just my CV, I suppose.
Right. Well, great. Thanks so much. I learned an incredible amount. I really appreciate you taking the time. I know everybody listening will as well.